Hi, my name is Serenity Medina, and today I'm going to be identifying parts of the heart and dissecting it to show how the blood moves through the heart into the body. So the first artery that I'm going to talk about is the superior vena cava vein. Now it's back here, and the superior vena cava vein is where blood from the head and shoulders are returned. The inferior vena cava vein it would be in this area, but I couldn't locate it because of the amount of fat that's on the heart. But this is where the blood from below the shoulders are returned to the heart. Now, this is the right atrium. The right atrium is where blood is pushed from the inferior and superior vena cava and is pumped into the right ventricle, which is right here. The right ventricle has blood pumped through, the blood is pumped through the right ventricle and is transferred into the lungs by the pulmonary artery. So right here is the pulmonary artery, and this is the vein that is going to lead the blood towards the lungs to collect oxygen. This is the pulmonary vein, and this is where the oxygenated blood from the lungs is returned to the heart. It's right here. This is the left atrium. The left atrium is where oxygenated blood from the pulmonary veins is pumped through here and into the left ventricle, which is right here. Now the left ventricle is where the blood is pumped and is going to go through the aorta, which is this really big vein. The aorta is where the oxygenated blood is pumped through the heart, and that's why it's such a big vein. The brachiocephalic, this is right here, it's next to the aorta. It carries the blood to the forelimbs and the head. So I cut the heart in half, and a way to tell the left from the right, this is the left ventricle, and it's much thicker than the right because it's pumping blood through the body, whereas the left ventricle is just pumping blood to the lungs, so it doesn't need to be such a thick muscle. And if you're gonna cut a heart open, use a small knife like this because it is such a big muscle and the cow is a really big animal. And it's also really tough to cut through. Now these little things right here, these are blood clots, and we're just gonna take these out so you can actually see what we're gonna be looking at. So deoxygenated blood will enter through the superior and inferior vena cava. This is the superior vena cava. And it'll go into the right atrium, which is on this side. And it goes through the typicus valve, which is right here. The typicus valve, it kind of stops and then opens as the heart pumps. And it'll go into the right ventricle, which is pumped through the pulmonary valve, which would be on this side, and through the pulmonary artery. And this will transfer the blood into the lungs to collect oxygen. This is called the pulmonary circulation. Blood then goes through the left atrium and sends the blood through the Bidgus valve, which is right here. And these are both the left atriums, but because I cut it in half, it seems like two different sides. So this is the Bidgus valve, and it goes into the left ventricle, and it'll be sent into the aortic valve, which is right here, and then out to the aorta, out through the aorta, and it'll be sent to the rest of the body. And this is really thick because it needs to pump blood all the way to the rest of the body. This is called the systematic circulation. So basically, to summarize what I just explained, when you cut the heart open in half, you're gonna see it looks like this. And the blood moves through the heart by going through the superior and inferior vena cava, which is right here. It'll go into the right atrium and through the typicus valve, which is on this side. and it'll go through the pulmonary valve, through the pulmonary artery into the lungs. And then it'll go through the left atrium, which will be on this side, the left atrium, and sends blood through the Bictus valve. Yes, the Bictus valve, and it'll go through the left ventricle, through the aortic valve, and out through the aorta into the rest of the body. And if you're gonna cut a heart open like this, you might wanna use a knife, like I said before, because it's a really tough muscle. But I'd also be careful because I almost made a mistake cutting the heart open, and it can get really confusing because this could have been on this side. So just make sure that you're watching where you're cutting, and that's all I have. So thank you for watching my dissection, and I hope it really helped explain how blood moves through the heart.